So during the COMy meeting, it was a great pleasure to discuss the role of microbiota in the setting of patients with multiple myeloma. This is a topic now we start discussing over the last years. For 2 to 3 years, we have some data that suggest that there is a link between the microbiota, and in particular the gut microbiota dysbiosis, and multiple myeloma. First, we have some data that show that there is a link between some bacteria and the achievement of minimal residual disease negativity, but it was only some correlative study, some association, and we don't have any direct link between what we see into the gut microbiota and the patient's outcome with multiple myeloma. Nevertheless, over the last years, there was some important publication, and in particular, one of the publications that directly link the presence of some bacteria in the gut with some mechanism of resistance to drugs, in particular Bortezomib, in these publications, and they were able to show that some bacteria that produce more ammonium that was associated with also some increased ammonium level in the blood of this patient, and this ammonium lead to a resistance to Bortezomib in some mice models. So it was some very interesting data because it clearly shows that there is a link between the presence of the bacteria in the gut of the patient and resistant to some very important drugs for the treatment of myeloma. Beside this link between response to treatment, achievements on the achievement of minimal residual disease negativity, there is also some data that suggest a link between the microbiota and the natural history of multiple myeloma, from the stage of MGUS to smoldering multiple myeloma and to multiple myeloma, and really thinks that in the next 3 to 4 years, maybe we'll be able to have some tailored treatments where we are going to manipulate the microbiota to influence into the response to treatment, but also maybe one day on the natural history of myeloma.